anything if you guys don't.
Nope. I'll see ya.
Thank you.
So we start with the pledge and then it's going. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So the zoning folks are here. So let's start with zoning and then,
I'm gonna go here.
so can you just have them come in when you come back? I still haven't found the one Carrie's looking.
I haven't either.
And Ty's been all the way through. He just likes things delivered to him, I guess.
I never did find that.
Hi, Jan. Hello, Greg.
Howdy.
We just approved your paycheck, so.
It's not signed yet, though, so you can't spend it. It's coming. Come back this afternoon. You can't find the courtesy method. I mean, this is far, but Ty's been through all. Oh,
You found it?
we're good. So
You guys gotta pay bills today.
time. So long as you found them with you, then.
You went out some more because there's tail day. Secretary brought them for moving the both.
Oh,
And
yeah.
she said she might cancel too much that.
Okay.
We are recording, the live is back and up and running, and I actually got it uploaded last week, and things are looking up, I guess.
You emailed me a copy of what we needed to get posted. I got it at Harry, got it in two places at Viber, post office, a John Deere, the C-store. Pick at the grocery store.
Good.
In all those places. So I can take care of it.
We're good.
So that was Tuesday, so you'll have it out there plenty long.
Yeah, oh, yeah.
So where are we at with their processing over the bid office?
Jerry has not been in. So
They are done, the girls told me they're all done going through all
here's what we've done.
the sex, yeah, the sex state. Now they're going through the votes or something, but,
Okay.
and they may be, I don't know, I haven't talked to them. I have no idea where I was last week when I talked to Carrie. And they had got all that, it was going through the votes.
I know the list is not complete, but I wrote down or I typed up what I had. So
That is not my name. You were looking for my name, that's not it.
yeah, it was, yeah. That,
Two N's and an A, it's Gina.
yeah, that's why this is ultimately just a draft. And it's not, and that's why I'm not making copies of it, because I know it was wrong. So, but I know I'm missing a name in this too. So, no,
When I typed it to her, I usually don't.
oh, yeah, trust me, because
I'm usually very, very, very bad at spelling.
well, that's why I couldn't find the one contract, because I had the wrong last name.
Yeah.
I spelled the name wrong, so I didn't, I'm sorry. Wasn't there somebody else though that you wanted on here?
Let's see, you know, John?
There are 5 of them.
Yeah, that's it.
Okay.
Yep.
All right.
That's,
And then John was sick last week, so I stopped in twice, but he was sick. So hopefully he's in this week. So am I gonna come back in this week and hopefully get some more stuff wrapped up on.
Offer you fellows an apology. I reread that House Bill or Senate Bill 11. And when I first read it, I presumed it, or in my first read, it was that it applied to all petitions before commissioners. It actually only applies to petitions to go on a ballot. So we're not under that time constraint. So I apologize.
Well, I got to admit, this is, because I'm working. It's a learning process for everybody. And as you very well know, the state is just not clear.
It isn't.
So,
So, but that's,
and then,
when I read that, I read it as a petition and then
yeah,
I went back and reread it. Well, I owe you guys an apology. So
No,
I
no, we're-
apologize.
we're good because we're definitely not experts on it. And then what I'm also doing is developing a policy so that it'll lay out everything that would make this process easier. You know, because we're flying the airplane while we're building it. So that's part of the reason of the delay. And so, we apologize for that too. And, but we're making progress. We have the date set. And hopefully by next Monday, we'll have what our 95% solutions on everything to be presented. So,
It's important that we take that clause out of it.
right. Yeah, well, and that's everything's siren. Everything's draft until that day. So then even on that day, what I think we should do is have the public hearing. Everybody gets to speak or read in if they've sent whatever. And then we're basically gonna have to take a break. Because I think some of the stuff is gonna be applicable, some's not, and then finalize it. You know, but it would be, like, if we take out paragraph A, it would be like, okay, it's the same except paragraph A was removed. Or in paragraph B, change happy to glad, whatever, but because that way it's all in one day.
Oh, that's it.
Yeah, well, that we were under,
Yeah.
that's our plan.
I did not miss that.
No, no. And we didn't see anything that would contradict that, so that's our plan. We just want to have, instead of having a draft of everything's draft until then, but we want to have maybe 99% is the good to go. So hopefully by next Monday, we've got it. Okay, this is what, because at that point, I want to put it online on the county website that says, you know, for whoever, because we're not going to make a gazillion copies, because then you're going to have, is it version 1, version 2? It's just online. Here's what it is. So,
I sent a question off to actually, I should let you know exactly where I'm up to. It's the tax policy and research office in Helena.
Okay,
And I'd sent a bunch of questions on how wind towers are taxed and how everything's taxed and the rates and all that. And I sent that to him. Actually, I sent it at night, so he didn't get it till the next morning. And by that afternoon, I had 2 pages of answers from him. So I was gonna give you these. You guys can, since you haven't had a chance to look at them, but go ahead and. They talk about the 3%.
Sure.
But basically, NextEra is. It's assessed statewide. All as one. They don't just take Macomb County and do that,
Sure.
you know, NextEra is assessed statewide. So anyway, and then actually, Paula just printed these out to me too. These are, and this is just 1 page of 30, she says. But NextEra is at the bottom and Clearwater Wind, and this is the rate that they're taxed by.
Okay.
Some different, like Northwest Energy and NextEra down here is all of a sudden at 1.5%. Which kind of goes against what the fellow in Helena told me that they're taxed at 3%.
Okay.
So we're gonna make an assumption, which may not, that's what it is an assumption. That the reason it's 1.5% is maybe where NextEra is they've got tax abatements from the different counties.
Oh, some have definitely granted tax.
But-
abatements, yeah,
So I mean, that could be the discrepancy there.
sure.
But it also shows, just in that thing. And this is just for information for you guys, so when NextEra hits you up with questions or the numbers they have, because I know I missed last week's meeting, but I watched it. And I talked to Wade for an hour and a half. But, where they just throw out the number of 11 million, I'm trying to find out exactly where that's coming from. Where,
Good thing you're a
why
young
are they-
man.
What's that?
Good thing you're a young man. If like,
Well, I am not. But, if you look at these questions that I'd ask, I mean, this guy in Helena is really good. I'm impressed. He's Eric Dale. But, it has the 52%. So out of the total revenue, the county gets 52%. The local school gets 28%. Countywide gets 5%. And then state equalization gets the 15%. But, so that's where the 50% and that number's been thrown around a little bit. That actually the county only gets 50%. But. So, yeah. Good information, and I'm gonna try to get to the planning board meeting and put this stuff there. And so they have it because I didn't, NextEra fellows were at the planning board meeting last. So
They could, there was nothing other than our setbacks were too far and the cost to put in for a permit was too much. At 800,000. My thought, county needs 800,000. We keep it right there. If we can.
yeah, absolutely. And these were just questions. I have a couple of others that I'm gonna try to pin them down on to. See. Because there's some talk about the. Somebody asked me to ask the question, haven't had on the power since the power is destined to go on state. Is it taxed also?
good question.
Otherwise. guess that's it. I guess I was impressed. Answering the question.
You got it. Good.
At the top there, it says sent from the previous, or I'd sent it from the wrong email, I think.
Yeah.
I sent it from Richard.
Oh,
Oops. Yeah.
Oops.
Anyway. So, we're gonna keep.
super. Yeah, and it'll be a reading file. We'll have all this in a reading file, so. But it definitely helped because I mean, the taxes were a big part of what everybody was asking, so it'll definitely help.
Yes, I just have one more question. Since they're putting the deeds with the petitions, if they find an inactive or something, will they give me a call so I can cure that?
Yeah, I think if they've had to fix anything, they've been fixing as they went along.
Okay,
So that was, I know at least on one thing, and I forget, either somebody had passed away or something was, but that was like a month ago, they were fixing something.
but they're fixing it, not throwing them.
No.
Oh, yeah, no, they're all, I have not heard of anything getting thrown out. I mean, you're way over the 60% anyway, but no, I've not heard of anything whatsoever rejected.
So the next step will be they present it to us for certification and then,
Well, we need them to finish it up, because then on the resolution, it's gonna have to address what the percentage is.
Right.
And then, because that's that, and I gotta take out the paragraph that you guys don't like. But then that public meeting will be, we have some stuff in there that some people have talked about, some people haven't talked about, between whatever we get for emails and the public hearing. Then we go through all that, and then if it matches, I mean, I think it's close now, it'll be close, it'll definitely be closer next Monday. And then we have the public hearing, everyone gets to say their word, there's, whatever they want to say, or present it in writing. And then, anybody else, if they're outside the area, that's great, they can talk too, and then I'll come down and I'll finalize the resolutions. We're gonna have two resolutions. I'm gonna do it the easy way and ask for a motion to approve the denying, and I won't get a motion. So that one's done. I don't have to read it. At least I don't plan on reading it. And then I'll ask if anybody wants us to read the resolution. What's it on the page? Approving it. And if somebody wants it read, because I mean, like I said, if I could change happy to glad or something, and it's relatively short, it's only 4 pages, 5 pages. Something like that. So if somebody wants it read, we can read it, and if not, then if there's a motion and a second, we'll vote. So at least that's my interpretation of how that's gonna.
Correct.
So, and then what we can talk about is if we want to do another resolution or who's going to be on the board, but we don't usually do that for boards. So we've got it. We'll just, when we update our board list for the year, we'll just have that in there. Because I think the meeting's going to go pretty long. So I don't think anybody's going to have any interest other than the folks that are getting on their planning board. The rest of them really won't care, I don't think. Or we'll have had enough of it by then.
I guess we chose not to do the call-in because it didn't sound like that went real well in Prairie County and
Yeah.
Yeah.
It's awkward and fast and,
Yeah.
very inefficient.
And this type 1 zoning is for whatever, 50 landowners. And they are the only ones that get the vote. So if somebody's really adamant against it, then they can come here and be adamant against it here. But of those landowners, I'm sure we'll get a good percentage. We've already got their vote. They don't even have to show up. So if somebody else from the outside wants to say something, they can, but they need to come here. Cause my impression from those phone calls, no matter what you do, yeah, so either somebody got in or somebody didn't get in. Well, if you want to come speak your piece, come speak your piece, because it's the people that are in that district to get the vote. And they will have already voted by that point. So we're having the public meeting just in case, I don't know, in case 50 people show up from that district and say, well, I've changed my mind. I don't see how that happens, but we're giving them the opportunity, you know, or however many can say, no, I'm withdrawing my, okay, you can withdraw, but it's already whatever. There's
Now, the responses we get by email, we'll have to have somebody like, I read them at the meeting.
what I assumed, because I think I put my email first, I've asked if you want it read, then let me know you want it read. And I will read as many as want read. I'm hoping that somebody does not send like 500 pages. Well,
Might
I mean-
next, get some poetry going.
so if there is something like that, if it's excessive, because we're not planning on setting time limits, but there's gonna have to be some kind of, if somebody sends me 500 pages of emails, I think if they don't live in that district, I think what I'm gonna do is do a summary of it. Because I honestly do not want to make people listen to 500 pages. If they live in there, then we'll have to do it. But I think I still do a summary and say, okay, of all these people in this meeting here today, who would like me to finish reading 500 pages? I don't see the value, and I'm not shutting off public speaking whatsoever, but I think that's a reasonable accommodation.
I have gathered from that I've been, the correspondence, either written or emailed to you, is correspondence for you guys to read and consider,
Yeah.
and not necessarily to be presented to the county unless, like you say, they.
Yeah,
That's what I would think.
Yeah.
I'm not sure you'd have to read it.
If somebody sent you 500 pages, I think you'd respond and say, you summarize this up in one page, please. So I don't summarize it wrong.
I think what I'll do is just, well, thinking about that, I think what I'll do, if you send me an email that says library, I got an email from Greg that said library, it's 500 pages, it's in our reading file. If anyone would like, they can come up and read our reading file.
Mhm.
So what's presented at the meeting,
There you go.
it gave the subject, because then you're right, then I'm not doing a summary of it, that, whatever their title is.
Right.
And then if the people sitting there,
Mhm.
but yeah, because somebody could be a jerk,
Exactly.
and they're not from here or whatever. So there's no value to, I'm not shutting off their public comment. I've taken it, it's gonna be in our reading file.
Yep.
And we'll try and get through it beforehand, but honestly, if somebody sends a huge volume a couple days before, we'll read what we can, but
Right.
I mean, 500, whatever the number
Yes.
is. So,
We
but
understand.
yeah,
Probably won't.
no, but I'm sure we're gonna get some stuff of, some people have some pretty lengthy things, and I don't have a problem with that. So,
And even on the comments that hopefully, we've all heard so much about. And it gets, a lot of it's repetitive, and hopefully they'll just be respectful of other people's times and give a short statement. And
Prairie County, people started getting mad when they got cut off, or there was gonna be a time limits, and Prairie County does some stuff and they limit it to like 2 or 3 minutes. It might be a long day for us, but I would rather, get your
They
2
cut
cents
us off at 3 minutes in Glendive too.
Yeah,
And, afterwards, I thought to myself, since I wasn't there,
Mhm.
I mean, I'm not in that county. I should have just given my time to a fellow that had a lot of information, and he was cut off.
Yeah.
I mean, he had all kinds of stuff,
Oh, yeah,
and I should have just given my time to him.
yeah, I think it just, to me, you start putting time limits, it starts getting hostile,
Yeah,
because then it's like, 3 minutes and 5 seconds.
yeah.
Well, you didn't cut him off at 3 minutes, so I should be able to go over, and I don't see it as possible.
I think if you start and say, people be respectful, they'll be.
Yeah, because I think who's gonna show up is the ones that are inside it. Majority, well, but, or have an interest in it, I guess, but
Do if next era shows up, will you let them speak?
Yeah.
Okay,
Yeah, it's a public meeting.
okay.
They're welcome to say their piece, but like we've talked about before, everything I read from Montana Code Annotated, this is type 1 zoning initiative. It comes down to 60% of the people in that district need to approve it.
Mhm.
So if 6 out of 10 people in that district vote for it, whether there's 1,000 more people lined up saying no, I don't see, based on Montana Code Annotated, how we can say no.
Okay.
Because it's not, the zoning does not say, you can do nothing but have rabbits out there. There's some setbacks, there's restrictions,
Sure.
but there's nothing that bans anything completely.
Right.
There's restrictions. That's what zoning is restrictions.
Sure.
And whether we like restrictions, we don't like restrictions, Montana Code Annotated, from the way I read it, and that's just me personally, it says if you have 60% of the citizens that have voted yes, that is the sticking.
Rick Colvin said that too.
Yeah, I mean, and I'm not a lawyer, I get that, but
And he is.
yeah, but I mean, all I can do is read Montana Code Annotated.
Yep.
And it says 60%.
Yeah, I agree.
Seems reasonable.
Right, but we're gonna list to everybody, but like if there's somebody from Texas or whatever, they wanna call in, I'm sorry, we're not gonna do that. This is here, it's a public meeting. And we're gonna have our owl to record what people are saying. But if you wanna participate in this public meeting, then you come to the public meeting.
Mhm.
Cause there's nothing that says we have to have phone or internet or anything else.
Sure.
So it's a local issue. The locals are here, the 60% is the sticking point.
Well, thank you guys for your
Yep.
time.
So Frank, did you go on the county website then, and listen to last week's
I
meeting?
did.
Oh, and it all worked.
Yeah,
All right, all right.
Did you guys cut it off at like 11 or? I kind of sped through some of it because I've heard a lot of it.
I don't recall that we
But
cut it off. Like,
You keep recording all day.
no,
No,
As soon
once
as
we get to our agenda.
we're done.
yeah, yeah, like this is set to be done at noon. So,
Okay.
but if we have something in the afternoon, I can set another time and save it and record
Yeah,
it.
no, it seemed all right.
Okay.
You always kind of worry a little bit.
Oh, he just got it back to.
Yeah, DIS fixed our problem.
Oh, but no, it sounded good. Yeah, I got it where I can get to it.
Yeah.
We'll see you next Monday.
Do you have something on the, MAF on the agenda for that too today?
The
Then we'll call
Yeah.
Valley Health.
Oh,
the money for the
That's
MCDC from that grant.
Oh,
we had done a retention thing, so they would, until the work was done and so we've got another 39,000 or something that we.
Yeah,
got.
McKinstry wants their last money.
Yeah.
With everybody agreeing, yes, McKinstry's all completely done. So it's just the holdback money on them.
And then we do have the house that they purchased. We were gonna put the county's insurance on that and they wanted something stating that we agreed to it. So I wrote up a little paragraph and sent it and they didn't accept that. So what they've sent back is 48 pages of what they recommend. So I sent Jackie an email saying that it looks like either an attorney will have to draft it up or the health center could provide the insurance for it, but yeah. So
it's insured now though through the county or not?
it's not.
No, it's not currently insured.
Yeah,
Total burden down.
Yeah, I know where it is. Yeah.
it's a brick house. It'll still be the walls there. Yeah.
Well, there's a steel building. know.
We didn't have a meeting in January.
Yeah, and then I just checked, I sent that email last week and I just checked and Jackie never responded to me, so I'll.
Christine on the phone.
Oh,
She was calling.
super. We're not kicking you out, but this is money for a grant, so you're welcome to stay.
You never did.
Yeah.
Thanks, guys.
Yeah, thanks for coming in. So we're recording. I don't know if you want to listen in or not.
Good morning, some Common Commissioners, Lonnie speaking. Oh, I'm good. Glad you called. You're on our agenda. And we are recording our meeting today. And just wanted to make sure you knew that, so we'll try and avoid the hunting and fishing stories again. You're on the agenda, I think we have a couple of things, the retention money. Yeah, our bill, and then also we have, I guess, there was another draw request, but we were gonna discuss that. My understanding is we'll go ahead and pay, is there two of them, Turkey Guard and Pulaski? And one beside, yeah, there was one for Great Northern that I think is approved in this.
That's the previous draft. This is from the previous draft. But there's a new one in there.
New draw request.
There's a new Great Northern one?
Well, a new one for the next, there's a little bit of Pulowski and then I think Uriah's a big one.
Yeah, there was something about having to move some funds. Okay. Okay.
The three invoices that will be on draw request 8 is Kirk Guard, $41,150. Pulowski, $5,160.36, and GNDC, $1,050. So those three, they sum $47,360.36. 1,050 will be coming from the admin, and $46,310.36 will be coming from, I think they call it activity or construction cost line item. We did have to move, let me look. We moved $4,910.96 from the admin professional services down to the activity construction cost line item to cover Kirk Guard and Pulowski. So by doing that, and then after we issue this draw request, you're going to be $0 at construction cost, but you still have $29,687.89 up in professional services.
How much of that can be used for construction?
Yeah, we can move that around. Yep. That's not a problem. We just, we would go through the same process as last week that you guys would have to send a request. Chandler needs a written request to file it. So that's not a problem.
Turkey Guard's last final payment.
Yeah.
That won't be the 41,000.
Yeah.
I think most of that was materials.
That's what I was wondering, if you guys wanted to kind of check in with Kirk Guard and Pulowski and just see if, if they think they're going to have any more invoices. The only other invoice that I'm aware of right now is McKinstry retention, and that is $39,750. And I'll be honest with you, I don't know where they're getting that dollar amount, and I have not asked because and you guys, if you want me to ask, I can, but I think it may be best just to leave it as is.
Carrie Eisinger is here and she went through that and
So on their bills for, let's see, June, September, October, and November, and December, they had a 5% retention taken off each bill, which if you add all those bills together, comes up to that 39,750.
Okay,
So I mean, I found where they got it from.
Okay.
We don't know how to pay them.
We weren't clear, when I talked with Carrie about it, we weren't clear on if we had received that money or if it was still grant money that it hadn't been. And Sherry's been, our clerk is really going through, her and her husband are going through some serious health issues. So she hasn't been around to ask all the time and Carrie wasn't clear on it either, so.
since those requested from the state, therefore Macomb County has not received those funds.
So what do we do? What do we need to do to get that retention funds done? Because that was the money that was held back to make sure McKinstry would finish what they promised to do.
Okay. So the way I understand, we would have to read the contract to see exactly, and I'm probably not in a position to give advice, but, you know, if you look in that contract, I think you're probably going to find something in there saying that they're gonna pull the retention fee back, and then if you're satisfied with their work, then they'll invoice you that retention fee and, move forward, close the project. So I don't know what, I would have to look, or somebody would have to look. I don't know, maybe your attorney might need to look at that wording on that contract. I can look at it and just direct you to it, but I don't think I can give advice on how to handle it.
Well, can we just request those funds? Because we just got to check with Jackie. The funds were held to make sure McKinstry finished. So we just got to
Right.
check with Jackie. If Jackie says yes, so can we just request those funds? Because one way or another, McKinstry's going to finish the work, but we think they're done. So can we just request that money through the state?
You can, you don't. You have the McKinstry invoice is $39,750.
So I don't know
How did we request more money? Because that money should have been held before we even looked at construction. Doesn't that make sense? That money never should have been available to put towards construction. Because the other problem is if these guys aren't finished, if Pulaski and Kierkegaard aren't finished, there's more money that's got to come out. So who pays? I mean, we can put off McKinstry again, but it kind of looks like their bills that somebody owes them money. Right? But somehow or another it got through
the nursing home doesn't have that money that we support them with that cover part of it, or all of it. So I don't, if it's,
Would you guys have anything in your minutes, in your commissioner minutes, that you guys would have discussed this retention to McKinstry, how you had planned to handle it?
Well, we know we talked about it because it was, McKinstry just wanted to hold back like $3,000. And we're like, there's no way. I mean, because they could walk away $3,000 or $5,000 was some small amount. So we agreed we wanted to hold back more, but for whatever reason, we thought that money was still on the grant that we could pull from. So that's the disconnect
was it
somewhere.
forgotten about? Or they did the second
Yeah,
part of it, if,
because that money should have been held before we even talked about doing any more construction.
I have a name here.
Yeah. So,
Let me check in with Chandler and see if there's something that I'm not aware of, if there was something held back when Brianna was still on the project.
because the,
I'm just looking at the draws that I have access to. Let me visit with Chandler about that, and I will give you, if I can get a hold of her today, I'll call you guys back.
was the McKinstry bill showing that holdback?
Yeah,
Was that McKinstry bill sent to the state?
I'm assuming, because these were all part of the draws.
Yeah, so,
So these were the amounts, you know, like this,
yeah.
and this was the helpful.
So Christine, that's what we thought was happening, is we sent the McKinstry bill. So we thought that somebody was tracking that money was held back, but, so there's a disconnect somewhere.
Yeah.
Cause we thought there was still grant money that was gonna pay that.
Yeah.
And then
Okay.
we'll try to find out from Kierkegaard and, Pulaski what they think they're still gonna need to get paid.
You guys on that. I'll see if I can get a hold of Chandler. Do you guys take a lunch break today, or what time are you done?
We'll be here till 5.
Okay.
We have a bid opening and actually Kierkegaard will probably be here for that. So we can ask him about this too.
Okay.
That's at 2:00. So
We're out from noon to 1, then we're in from 1 to 5. So,
Okay. Okay. Very good. Let me see if I can get a hold of her, and then I will, I'll give you guys a call back.
sounds great.
Perfect. All right. Thanks.
Thanks for calling.
Uh-huh. Bye-bye.
I think there's gonna be a shortfall of funds.
yeah, we didn't know either. So,
Well, and does Lonnie have to sign that instead of you because he was on the original? Or was it the opposite? You were on the original?
we'll get to the signature. Oh, commission chair, so that was gonna be me.
So you found the Curtis repair one? This is it.
Well, there's should be.
There's several of them together.
There's
There's
three, because they just
public safety.
literally got the same.
Okay. So, we'll listen to Pam and then we can do the minutes after that. I'm gonna be pretty disappointed if this grant runs out of money. I mean, that's why we sent in the bills for McKinstry. Come on in.
Come on in.
Fair warning, our owl is listening even as we speak. Can't take your picture, but it can sure hear what you're saying.
Okay.
All of a sudden she lost her voice.
Yeah, yeah, she looks at her watch, ooh, time to go.
Oh, yes. I know, all these meetings are being recorded now, right?
Yeah,
So yeah, I have to remember to not swear.
yeah. Careful what jokes you're telling, yeah, the whole 9 yards.
Yes. How are things with you guys?
Good. I think good, yeah.
Interesting times. We have zoning going on. We're gonna open up a bid for a building at our fairgrounds. We're gonna move the old fairgrounds building within a week, so interesting times.
Well, didn't you lose a building out there?
Yeah.
Yeah, last year in March.
Burned to the ground, yeah.
The whole building that we.
Yeah,
The good building.
The good
the
building.
good building. Of course, it was a good
Yeah.
building. Gosh, that's too bad.
Yeah, and then the Quonsets on the side are damaged. We're gonna move those out and use them for storage for the road crew, or try to.
Mhm.
Hopefully they don't fall apart. And then hopefully this year we'll start building a building to replace the whole footprint. Hit your alarms and get them going.
Yeah, whoever's calling me from Oklahoma City, I'm thinking it's probably good that it's probably spam is what I guess.
How many phones you got? You like,
Yeah, well, it just made me think, I'm gonna turn them both off though, right? So. You guys ready for me to get started or?
You betcha.
Yeah.
Well, first of all, thank you guys for being a partner of the Healthcare Trust. Long-term partner. Think as long as I've been around. And, before we really get started, are there any issues that you guys would like to address with me?
Haven't heard any complaints, so no news is good news.
Have none.
Okay. Well, I would agree. When it comes to health insurance, no news is good news. And when I was driving here, one of my coworkers asked, do you have good news for Macomb County? And I'm like, is there such a thing as good news with health insurance?
Yeah.
But I don't have bad news, so, or I don't think it's bad news, so I think it's, I think it's fairly good news. First thing is, you guys want to review your plan performance report? This kind of gives you a heads up of what's going on in Macomb County, and it's on the left-hand side behind the agenda. Some people like this information and other people are crazy about it, but I kind of think it's a good thing to review, just so you know, what is driving experience here. Kind of the first page, demographics, average age. Macomb County is slightly older than the average of the West.
Just can't leave that alone.
Nice overseas.
50 compared to 46. And, average age of members, same thing, just a little bit elevated compared to the rest of the trust. Up above that financial dashboard, one of the things that is a nice thing maybe to share with your employees is that they are picking up about 19%. That's down from 21% last year of the costs of the medical care. So really what that means is, just on a whole, typically speaking, they're paying kind of their 20% or about 20% because they have their deductible and their out of pocket. You have 100% of your claimants of your, employees have a claim this year. So that's not a bad thing. Some people think that's terrible, but it might just mean that they had a preventive screening. They went in for an annual physical or whatever. Your pharmacy is running about 44% higher than benchmark. And so, little bit high on pharmacy. Coverage by relationship class, you probably know that you don't have a lot of dependents on your plan. They're pretty much all employees. And so therefore, your total prescription and RX claims are really just driven by employees, not so much, spouses and children, things like that. Pretty much that's what it covers also on page 3 is that relationship class, where it's, really driven by employees, not by your dependents. The bottom of page 3, your current risk score. It does look like it's a little bit higher, almost a 1.5. And benchmark would be a 1. So, and Mako overall, it looks like your risk score is slightly higher than Mako. But, even Mako's is over a 1.3. So, you're right in there with that. What's driving your claims currently, this is on page 4, your utilization metrics is really outpatient So that's gonna be outpatient, therapies, could be outpatient surgeries, those types of things, and pharmacy. So very little that's driven by office visits. And even inpatient hospitalization stays have been considerably lower than, than outpatient, which is really kind of the norm now. Page 4, it looks like, bad thing about some of these. You look at them and you think, why does the highest dollar increase from the comparison period last year to this year? And you look at influenza and you think 75,000. Well, that could just be one case that somebody ended up in the hospital. And unfortunately, in a small town, you guys might know who that is. I hope not, but so nothing alarming there. And then the largest dollar increase this year over last year came from imaging and radiology. And then operating room, ambulance, it looks like there must have been an ambulance, none last year and one this year. No inpatient days last year and a little bit this year. I always like to pay attention to the bottom of page 5. Hypertension it's usually the number one driver of chronic health, or it's the number one chronic health condition in almost every county and in the healthcare trust overall. And you could see a group your size benchmark says we would expect to have 6 and we have 9 here. Hyperlipidemia, which is high cholesterol, technically you're under benchmark there. You only have 5 and they would expect 6. Depression and lower back, just what they'd expect. Metabolic disorders. So you can see that, really hypertension is the only thing that's kind of maybe off the charts a little bit. The good thing is, typically speaking, hypertension isn't expensive to treat. And one of the things I'll talk about today is a new program that we're rolling out called Hello Heart. And the reason I'm mentioning is I've been to 2 counties and people have mentioned to me that they weren't sure if it was, a legitimate offer or not. But so I'll review that with you because it's just a program that almost anybody can participate in if, any woman that's probably 40 or older, anybody that has high blood pressure, anybody that has a cardiac condition, anything like that. And they guarantee us a 2-for-1 return of investment, but they'll actually send everybody a free blood pressure cuff, and they're the nice ones, and a way to kind of help people manage that health condition. So maybe next year that number will be a little bit better. Your Care Alert score. Care Alert just is an indicator, are people getting the care that they need? And I think there's nothing here that looks alarming overall. It doesn't look like people are not getting the care that they need. Emergency room visits. Some places that this could be a real driver. There's a county that they have 2 people that I think between the 2 of them have been to the emergency room like more than 20 times in a year. And so things like that can really, drive claims just simply because it's expensive to walk in the door of the emergency room. Unfortunately, when you live places like we live in rural Montana, you don't have a lot of options. You either go to the emergency room or drive to Blind Bag and go to the emergency room there. Because it's not like they have a walk-in clinic there either, I don't think, do they?
Well, they do, but it's not open all the time.
Yeah, like in Lewistown, we have Benefis came and put in a new place. But, they're only open, I think, till 7 o'clock on Monday through Friday, and then they're open very limited hours on the weekend. So, that might help a few emergency room, but it's, most of the time you're gonna have to go to the emergency room if it's after hours anyway. The good news is that the people who did go to the emergency room, they went from, legitimate reasons. the number one is life-threatening, high severity, and moderate severity. So what you don't want is you don't want people that are going to the, the emergency room, for things that like, one of the counties I was looking at it, and that's over on the next page. They went for, here, it was acute upper respiratory infection. Well, when you can't breathe, because that's what an acute upper, you're gonna go to the emergency room if you can't breathe. And sprains and strains, a lot of times you don't know if you sprained or did you break something. And so at least the people that are using the emergency room are using it, for good reasons. Like I had somebody in a county that went and it literally said preventive care. So it was something they should have been getting from, another doctor. And here you'll be able to see pharmacy, kind of what's, the largest driver. The very first Benlysta, that's probably, nobody took it last year. And so you can see that, somebody's taking it this year. And so it looks like it's, a lot higher, but it's just simply because there was no use of that last year.
The one is dog.
What was that?
What is that?
I think,
It's for lupus.
yeah, I think that's what it's for, too. So, in the terms of Eliquis, the next drug over, and Mounjaro, those are probably drugs that, the cost of them probably just went up this year. And the other two are drugs that nobody used last year. Nothing, same thing, miscellaneous reporting, that's probably that been listed down below at the bottom of page 9. And it was just, there was nobody that took that drug. It's probably a new drug. Single source brand, it's about 81%. So that's what's driving. Like that Benlysta, I bet you there's only probably one place that you could probably get it. It's, probably a brand name. And so that's probably why your single source brand increased from 64% last year to 81%. And I bet that's all it is that one medication. Kind of the average for Mako, about 76%. And that just means that people are taking drugs that you only have one option to buy them. It's not like like if most diabetic drugs like metformin or, high blood pressure, like lisinopril or whatever, they have multiple manufacturers all over the United States that do them. And those are probably brand name drugs that are not. So pharmacy age by, your age band. In your situation, a lot of times you think, it's the people that are older that, cost more on medications. It must be somebody younger that is taking an expensive drug. So, really that looks pretty good. You have 3 members who had claims over 50,000. So just remember, anytime you have a claim that's over 50,000, that gets shared with everybody. And on the flip side, the counties that have claims with 50,000, that gets shared back with you, right? That's where we do our pooling point. There was discussion this time is, should we use our pooling point at 75,000? But here you have 3 of them that we would consider high cost claimants, and pooling picked up $62,000 for your group. The next page, there's a scorecard that really just focuses on pharmacy. Your gross cost for pharmacy. It is small print. It's hard to read. It's the top of the next page. Gross cost, it looks like it increased. The prior year was 41,000. This year it went up 111,000. So that was 166% increase per employee per month. Last year was just over $100. This year, it's just over $250. And the plan cost increased by 163%. And then the plan cost per employee per month went from about $92 to $228. The patient share increased slightly from 9.6 last year up to 10.8. So even your members are picking up, about 2%, a little over 2% more this year than they were last year. Just trying to see if there's anything. I see anything too alarming. It looks like at the bottom section, patients with key conditions. So these are going to things, diabetes, circulatory, that's going to be, your high blood pressure, which is what we kind of talked about, and then mental health. You can see your number of employees or members that are on the plan. 5 for diabetes, cardiovascular, circulatory 17, and mental health is 9. And down below, we can see, drugs that are driving. Costs here is that Benlysta, Ozempic, Eliquis, mental health medication, and Spiriva, which is a respiratory for people usually that have some form of asthma or whatever. I think they needed to make this print just a tiny bit higher.
You just move your heads to adjust your bifocals for that, you see, and then it works.
I can read it, but it is pretty dang small, right?
Are you gonna tell me you weren't there yet?
Oh, no, sometimes I have to find a pair of cheaters somewhere, but
You got an extra pair.
yeah, I bet you do. There's always somebody that has an extra pair, thankfully, right? Wellness screening, that's what's the next page. So total participation, you had 16, there were 13 in the fall. There were 9 people that did it this year that hadn't done it in the previous reporting period. So that's good. And you can see that your participation in the spring was at 46% and in the fall was at 37%. So we've started to do it twice a year just because we think there are some people that, we're not saying everybody has to do it twice a year, but we know that there are some people that maybe, have a good reason that they would like to do it twice a year. Especially if you're trying to monitor, things like cholesterol or, your A1C, things like that. So the next page, I never get too worked up about blood pressure. You can kind of see the difference between the males and the female from the spring screening to the fall screening. Looks like all the males that came in the fall had high blood pressure. I don't know, was that right after the building burned down or, so, and then your females in the spring screening, the males were the ones who had their hemoglobin A1C were considered out of range. And then in the fall screening, it looked like the women, females maybe had, quite a few of them had an A1C that was out of range. So lipid panel, that's going to be your cholesterol. Looks like that was kind of women that maybe had out of range numbers there. Nothing concerning on liver function, comprehensive metabolic panel, or CBC. It looks like during the spring screening, I'm over on the next page, there's probably one female that, or maybe a couple that their thyroid was slightly out of whack, but everybody was in range back when we came back in the fall. And your vitamin D, which always can be a concern for people in Montana. In the spring screening, about 43% of the males their vitamin D was out of whack, and fall screening, about 60% of the females that were screened. Looks like everything was good with the PSAs that they tested. And then the last page is referral, which is telehealth or telemedicine. And all I can really see is that there was no utilization. So sometimes people forget about telehealth and how useful it can be. I know of one example of somebody here that had used it. It wasn't this year that they used it, but they were outside working on a Friday and put their hand in, either it got bit by something or put it in, you know, poison ivy or poison oak or something like that. And their hand swelled up and they were able to call into telehealth. And they were able to call a prescription in, and I think they called it into Wolf Point, if I remember correctly. So they were able to go up there on a Saturday morning and get it. But then by Monday, they were fine to go back to work instead of waiting all weekend. Sometimes, like, it seems like women typically get urinary tract infections. If you've had one, you know exactly what they are. And I always thought, well, you'd have to go in and, you know, pee in a cup or something. But you can actually call and they will prescribe a medication. So a lot of times if you have a sinus infection, something like that, telehealth is the way to go because it's fast. You don't have to have any special equipment except for a phone, and they're inexpensive. So much easier than using like an emergency room or something like that. So that's kind of, you know, as you can see, you guys really had a pretty good year with us. The renewal letter that is on the first page, we've given you a 12-year history. And I can tell you that the Healthcare Trust, we set our rate increase this year for a 5%. So it seems early. We literally just set them on Thursday, and here I am on Monday. And, you know, this won't go into effect until July 1, but the average rate increase for the trust is 5%. And the experience with Macomb County fell right in that norm. I was gonna take a look and see. I
I
think,
was gonna say for us, that's a low rate. Low rate of increase compared to what we've had the last couple of years.
well, it's because the trust had a much better year as well. So, you know, how did you run compared to the trust? I know last year you guys didn't have a loss ratio over 100%, but it might have been, I don't remember if it was the year before that or whatever, but this year, without pooling, your loss ratio without pooling actually was under the average of the trust. So what I mean by that is, you know, even though we took that 60-some thousand out, you still ran better than some of the other counties. But, and with pooling, so that 63,000 that we took out for those 3 members. So any of your claims over 50,000, you guys ran just slightly higher than the average of the trust, but not high enough that we adjusted your premium either way. So just we're given the average rate increase. So that's kind of what you'd be expecting for this next year. You know, I think I told you guys last year when I was here that we moved our prescription drug coverage to be with NACO, the National Association of Counties. And we've been seeing about a 40% reduction in the rate of our cost of our medications. So you're only going to see that, you know, for a year or so. And then after that, that becomes your base point. And if the next year it's kind of the same, or there could be people taking new drugs that are more expensive, it will start to go up. But that was a huge savings to us to switch that, to switch our drug plan to be with the National Association. We were actually the first organization anywhere in the United States that joined with NACO. And now they have counties in Texas and California that are probably, I don't know, I think isn't LA County like over 100,000 people or something. They're huge. And so now we're in with very large, so I would expect that our experience or the cost of medications will really stay pretty stable and flat. Just simply by being part of the National Association of Counties. So when your ID card says CVS, that's all that really is that it's the CVS program through the National Association of Counties. And so that's what helped our plan, you know, both this year and last year. You guys have any questions about, do you want me to go into any more detail
We're good.
about that? Okay. The next page, I've given you a copy of what you're doing right now. So this first page that looks like this, it doesn't have yellow at the top, or very, very little yellow. It has your logo at the top. On the right-hand side, that's your rates right now today. And I'd like to give you that because I think a lot of times people want to know, well, what did it look like last year versus what it looked like this year? So last year, your contribution was $1,174. And that was based on the basic plan, the BP 2000. So you can see that if you keep your contribution the same as last year, it would go from 1174 to 1233. I'm not saying you have to keep your contribution the same. Are you following me, Lonnie?
Mhm.
Okay,
What's the BP one? And like,
yeah, it's the third plan down. So I'm not saying you would have to keep your contribution the same, but I just kind of wanted you, you know, to know that would be, you know, kind of the difference between this year and last year. This year I had Joanne run a report quick for us, just because I wanted to know what was the average contribution for their employees per county per month. And you guys are actually a little, I know it might sound like you're not, or, you know, let's face it, $1,174 is a lot of money, or $1,233 is a lot of money. But last year, the average for all the counties, for what the counties were contributing to their individuals' health insurance, the average was $1,311. So, you know, even at $1,233, you'd be, you know, $100 lower than the average. And I sometimes still can't get over, you know, that health insurance rates are over $1,000 a month, but when you look at what the cost of care is, you know, I can tell you that some years we need every dollar that we collect in order to do that, in order to pay everybody's claims. So there were no changes in dental, vision or life rates. So they are going to remain flat. They're going to be exactly the same this year compared to last year. And of your 31 members on the plan, you can see that we have 3 that took the RM 2000 plan. I'm on the 2026 renewal rate sheet right now. So you can see that you had 3 people that picked the most expensive plan. That meant that they were paying the difference out of their pocket for the premium. You had 2 on the RM 3000, and then the bulk of your employees, 25, were on the basic plan. And you have 1 that took a high deductible health plan with a 3,500. And even though you don't contribute to the HSA because there's not money left over, if you were going to have a baby, or if you knew you were going to hit your max out of pocket for the year, you knew you were going to have surgery or something like that, even though it's a high deductible health plan, it still has the lowest max out of pocket. And so that still can be a viable plan for people. And you can see that you have 1 person that had kids on the plan last year, but everybody else was just insuring themselves. If you'd like to be able to offer a plan that was less expensive than what, you know, the contribution is, you can look down at the alternate plans. There's a high deductible health plan with a 4,000, a 5,000, or 6,000 deductible. That's under the green alternate plans section. And every year we like to review, if you have family-friendly rates or not. Macomb County has our standard rates that our actuary has set, so you do not offer family-friendly rates. And a lot of counties, if they don't offer them, it's really a hard change to, what would make them family-friendly. And, the way you make a rate family-friendly is by artificially inflating the single premium to bring down family premiums. And at this point, I don't know that you would want to move in that direction at all. I think you're probably doing fine just where you're at. The second to the last form is the contribution and eligibility. Your eligibility is based on 87 hours a month, which equates to 20 hours a week. Do you guys have any 20-hour-a-week employees?
Yeah.
Up to you? Okay,
Please.
and
2.
Very,
Carrie and Nancy.
just wanted to make sure that,
Some of the dispatchers might be.
yeah. And that might be a really good thing to keep, your contributions set there, or your eligibility hours set at 87 hours a month. It was simply based on, sometimes it's hard to get people to, take those positions.
Well, that's it. It's a pretty good employment draw. Because we're not known for paying the highest wages.
So, do you guys see any need that you would want to change that or alter that? I think what you're doing is great, if you can afford to do it.
No, I think we stay with the same plans we've had.
Okay.
And I just think that we change the contribution amount to the 1233 to match what most people are on.
And leave the eligibility the same still?
Yep.
Okay, and, your payroll cycle, you guys are you paying monthly still?
Yep.
Okay, I didn't know if you guys had moved to,
No.
okay.
Once a month is enough for me.
Yeah, I know it is. People who aren't working 40 hours a week, do you guys prorate the amount of their contribution at all? They get the same amount, don't they? The 11.
I think so.
Yeah, they either get health insurance or they don't.
Yeah.
And it would be the same, just like as if they were,
Yeah, as long as you're working 20 hours a week.
yeah,
Yeah.
good, okay. You've always said that,
So how do we check that? Do we check that as yes or no? For the part-time prorating?
you would, part-time prorating would be no.
No, okay.
That just means they get the full contribution. And the coverage just covers the employee only, so that's how much is in the plan. And if somebody didn't take that plan, they could also use it for their dental or vision, I'm assuming. I think we have somebody doing that.
Yeah. We agree to pay their dental and vision if they don't take it out.
If that's how it's been in the past.
Yeah, because I think there's a couple.
Yeah, there's at least one that I knew of. You don't provide any extra life insurance. I'm assuming you want to just keep that the same.
Correct.
And, there's no contributions into HSAs, HRAs, or FSAs. And the employees, do you guys allow them to participate in flex or HSAs? That's what I thought. And you guys offer no cash in lieu. Because this is a notice meeting, if you guys want to just sign your stuff and get it turned in today or me, or,
think so.
okay.
Do we agree that we're gonna do the 12:33 for
I agree.
I agree.
the, oh, I guess they should have a,
Like,
yeah. I'm not gonna listen to anything. Okay, so Bonnie, you'll second Ty's motion.
I got her. Yep,
Okay,
I second it.
all in favor, say aye.
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 On these charts, you know, with our low amount of employees and our insurance,
Mhm.
one big bill or occurrence really affects the percentage, doesn't it? On the chart.
Yeah. The thing that really would save you guys is the cooling. And like, for example, if I go to county like Garfield County, they're gonna get a higher bump. Because what happens, you had 3 people that had claims that were over 50,000. So we take that 50,000 and share it with everybody, right? Well, what can really happen, and then, Alan, I'm gonna have you just check the same plans that you have on your rate sheet. Yep, just check those. I think we already checked dental and vision for you and sign the bottom of that. And if you want copies of this left here, well, I guess you took a
I
copy.
just took a couple.
Yeah, if you want to offer the same plans, which I think are great. It's good enough to do that. But what can really hurt a county would be if you had a lot of people that were bumping up against 50,000, but their claims didn't go over 50. That's what really could hurt you, and you would have a rate increase more than the average of the trust. So in that first letter that I showed you here, you know, over the last 12 years, you had 2 years that you, I mean, at least that was a long time in 17 and 16. You know, you had 2 years that you guys had kind of tougher claims experience than the average of the trust. But ever since then, you've really just ran far with the trust, and so. But yeah, it could be really hard with a group if you didn't do pooling. You know, because that anything over 50 does get taken out of your experience. So. Did I answer your question?
Yep.
Okay. Right. The very last thing back here was that Hello Heart that I wanted to make sure that I mentioned. So, you know, people can just scan that QR code, but we have partnered with, Hello Heart. They'll send you a free blood pressure and heart rate monitor. And then you have access to do a heart health tracking app. And, they'll give you information just about, you know, better monitoring. So I'm hoping that maybe some of your employees are aware of the program, and I'll be talking about it when I'm here for open enrollment, since we know that, you know, that's the chronic health condition that a program like that will probably help. With some of those. There are a few things.
We got an email about that.
Yeah.
Yeah, you did.
And I started to do it and then I quit for some reason. I don't remember.
Well, you know, I had a lot of people that thought it might be, you know, spam or something. In both counties, I was in Bighorn County last week, and what other county was I in? And I had people in both counties come up to me and say, "Is this real?" And I'm like, "Yep, it's real." So, and honestly, I've done it too. I've had them send me the blood pressure monitor, but we are going to be doing demos of it at the Billings NACO conference. And so I haven't even like personally loaded my information and set my app up, because I don't want to, you know, do that and then have like 20 people try my, you know, take their blood pressure on my records. So I'll start it after the NACO conference. So we just want to be able to show people, you know, that it is an easy program. There were a couple things in here that I wanted to talk about. Allegiance has set up a bunch of additional telehealth programs. And they are page 6 and 7 in this book.
Which book are you in?
The bigger, the fatter one, sorry.
Yeah, the telehealth is great. I didn't know it was an option.
Yeah, I forget about it too, you know, and
It would be good to like
Roger.
send out a mailing or something, or give us something we can put in our paychecks, something like that.
We have sent some stuff out about it, but it's been a while, and so we'll make sure that we talk about it. So in here, these programs, you know, there's, basically a woman's program, there's a cardiovascular program, which we would probably prefer that people did the, Hello part for right now. And then there's a program for people that have stomach issues, gastrointestinal issues. There's a program for that. And then virtual care clinics, a lot of that is going to be, there's 3 different ones that are all for mental health, depending on what kind of counseling that somebody wants. So there's Talkspace, Bright Health, and Maruth. So I wanted to mention those are all telehealth programs that are new from last year. And the other thing I wanted to mention was Site of Care. So Site of Care is a program that we just started in January. I doubt that anybody, I don't think anybody's getting contacted yet, but it's not going to affect a lot of people. But I wanted to mention it in a meeting like this because if you have somebody that comes to you and say, what the heck our insurance is doing, but they want me to move my care. So this is only for people that are having infusions. So it could be, you know, an infusion for cancer. It could be an infusion for, you know, some kind of a serious health condition. Like my uncle told me, he called me on the way driving here and he has prostate cancer right now. He lives in Oregon. He does an infusion and it's actually once every 3 months. And so he has to go somewhere and every 3 months have this infusion. I'd never heard of it before, but that would be an example. If Allegiance finds that there would be someplace less expensive for the member to have it, they will contact them. They're not going to tell the member, you have to do this, right? So let's say that you have somebody that's going to Sydney or Miles City, and they find that it's, let's say they find that it's $20,000 less for somebody to go to Billings to have it done. If it's an infusion that somebody's going, you know, every week, they're not going to want to drive to Billings because it's probably a lot further. But if it's something they're doing once a month, they might, because this is what the incentive is. The incentive is the employee can get $1,000 per infusion, up to $4,000 a year back. So if you have your basic plan, that means that essentially by them moving their care somewhere else, they would have essentially got the $4,000 to cover all their medical expenses for the year. Members aren't forced to do it, but they will be told about it. So we don't use a care, like some places, we have the option of just saying everybody had to move, but we're not going to do that to people. We have way too many people that live in rural Montana, and you know, we have, like, if my best friend is a nurse in benefits at Great Falls, well, I'm going to want to go there because I know she's going to take care of me, right? Instead of, even though Billings is only 20 miles further, I wouldn't go to Billings. I'd probably go to benefits because my best friend is a nurse there. But if somebody said for $1,000 an infusion and they're going to actually give me a check or, you know, give me cash to do it, I might. And so people aren't being forced to use this program, but they will be notified if we know that there's somewhere that, and we have to save at least double the amount of, you know, there has to be an incentive. And they've said it has to be at least a 2-to-1 ROI. So we're not forcing people to do that. We're just saying, hey, this is another option. It would save the plan money. You know, usually for the employee, they're not going to care because you know, you're gonna hit your 4,000 max out of pocket and anything after that, we're gonna pick up. Right? But if they knew that they could get $4,000 back, they might consider moving. We're not gonna be asking them to move like, you know, to an infusion center 5 states away. Right? So I don't think there's gonna be a lot of that here because,
Only have some,
yeah, exactly. So I just wanted to mention it. It might not ever come up, but I don't, you know, I wanted to at least mention the program to you. The other thing we did this year is we issued an RFP for a new TPA. So we know that we've done business with Allegiance for a long time and, you know, we know that we have a good relationship with them and we feel like we've gotten good discounts. Well, we actually hired a consulting firm, Gallagher. The PC Trust uses them a lot. And we hired them because we felt like to really evaluate claims. So what they did is they took a year's worth of claims from the healthcare trust and they ran them through a system. And they ran them actually through 2 different systems and they confirmed that we are getting the lowest pricing or the lowest cost available at hospitals. So what your hospital over here is going to charge Allegiance, us, is going to be less expensive than any other carrier like United Healthcare or EBMS or anything like that. They ran it through 2 different programs and realized that we are getting the best discounts that there are. So because of that, we opted not to change TPAs, which is probably, you know, slightly easier for everybody. So I just wanted to kind of throw that out there that, you know, we are doing our due diligence, but we really anticipate that we've done the right thing. The other thing is we've kind of tentatively set the date for open enrollment to be Monday, May 4th. And I don't know, does anybody have any qualms about us being here on a Monday? Probably works.
It works the best for us. So I mean,
We'll just have to remember, you
I
know,
don't think
this-
there's anything else going on.
okay, we'll just have to remember to send. I don't know that anybody, I might have only sent the email to Sherry and I know she's been out quite a bit, right? Still.
We'll have it on our agenda. Something.
Is it in your calendar? I don't-
It's not yet, but there's nothing on. me.
Okay, do you want to put it on there, Monday, May 4th? But we want to do the wellness screening and open enrollment that day. And I might resend the email that I sent her. I would have sent it probably around the end of the year. I think it was in December, maybe the first week in January, and I'll probably resend it to all of you.
What time frame are you looking at?
It would start probably 7 or 7:30 in the morning and I think be here most of the day.
Okay.
So I'll
So
resend.
is this where you're gonna start at the South Road shop and then?
You know, I think we're gonna do the wellness screening down here if we can find a place to do it. I think you
Yeah.
guys did find a senior
well,
center.
yeah, you use the senior center.
So we would probably just. And last time, all those guys came down here for it.
Yeah.
They for the screening, and so we'll just do
Yeah.
their open enrollment when they come to
Yeah,
it.
senior center should work.
Okay. Just making a note to resend the email to all of you. And to Carrie. I'm not sure if you guys, and maybe somebody in here knows, maybe they don't, maybe Sherry would be the only one, but do you guys know if you guys opted in for our GASB OPEB order, offer? Who's doing,
Those ring a bell.
who's doing your AFR or your annual financial report?
I think.
Well, we have an
I think
auditor,
the-
but Sherry
I
puts
think
together all
more
the books.
Kind of used to be part of them.
Right. Okay,
Sure, it is in there.
So I've had some counties, in fact, Fergus County was one who just called like 2 weeks ago and they said, hey, we need to take advantage of that. So GASB, you know, that's your governmental accounting, and the OPEB is your post-employment benefits. There's a space for reporting on your annual report. And if you don't do it, you can get dinged for it. And we have an offer that because you're a group under 100, we'll pay for to have an actuary run the calculations. We send them because they're looking at who's on your health plan, right? So we send them most of the data. And I think there's maybe one or two things that the county has to fill in. I can't remember it. Like it might be date of original employment, or it might be something. But just know that that's a free offer. And so if you're getting dinged on your annual financial report for that, just know that, you know, we'll have that calculation done for you free. We've hired an actuary. We do the bulk of the work by sending them the information. And so if that comes up, you know, don't hesitate to reach out to us. We're still doing our Monday Money Talks, the second Monday of each month, and they're typically going to be, you know, about payroll, employee benefits, those kinds of things. Nancy Everson, our finance person that we've hired at Mako, does those, or she coordinates with us. I think this month it might be on, I think we're going to partner with Ampera or PERS, and I think it's going to be on retirement for people. And then we always do finance training in the fall. I don't know if anybody from here has ever went to it or knew about it. But I wanted to make sure that kind of, you know, next steps, elect the plans. You've already done that. The online enrollment will begin as early as April 1st, and it will go through June 15th. That's open enrollment. And just, if you were going to leave the trust, you have to notify us by March 1st. But I don't think we're concerned about behavior.
We're not leaving.
Yeah, a group your size, this really is probably the best thing to do, is to be in the healthcare trust. You know, just kind of as a reminder, you know, we do try and keep the rates stable. There's always lots of conversations with our trustees, you know, with county commissioners that sit on our board. Like, our actuary said we could have a rate increase as little as 2.5 and as much as 7.5. That was his recommendation, and the board just split it. And so that's, you know, they're the ones that make the decision about the 5%. But I think that we've kind of learned our lesson. You know, there were some years where we didn't have a rate increase. And then, you know, we don't have a rate increase for 2 years, and then we have a rate increase of 12 or more. And so they've kind of learned their lessons. We're not going to do that anymore, which I think makes best sense. But so that's kind of where they landed at that 5%. So really, there's just a lot of volatility in claims right now, you know, and the cost of care. It's rising dramatically. We have more large claims than we've ever had in the past, but financially, we're still doing well. We're just really kind of felt like, you know, medical, people will say inflation is 3%, but medical inflation is actually higher than regular inflation. And so, you know, we have to kind of keep that in mind. Do you guys have any questions for me?
I'm good.
Yeah, I think we're good. So I would just recommend you know, telehealth, I would send us something we can put in our paychecks or something, so everybody can see it.
Okay.
Is that contact information? Is it on our insurance card, or how do you?
Yeah, you know, now the ones that are in this book, you actually would have to go to the book.
Okay.
But for regular telehealth referral, on the back of your ID card. So you don't have to look anything up. Like if you just woke up one day and had you thought I have a sinus infection, you just call the number on the back of your ID card. And now if you had like a rash or something, they may want you to set up, you know, either like a Zoom or, you know, if you have like FaceTime or something like that on your phone, so that they could see the rash. But a lot of times things like that.
Telemedicine right there. Lower right-hand corner.
Right.
How about that? Who knew?
Yeah. Only look at that when somebody asks for
Right.
for it.
Yeah. And I'm getting you guys out here to go in time to go lunch, right?
Mhm.
Yeah, if you're good, I think we're good.
Okay, well, thank you for letting me come in and see you guys. It was good to see you. And thank you for being a member of the Healthcare Press. It was appreciated. And I'm assuming maybe I'll see some of you in Billings.
Make it.
Yes, we're planning on going.
I'm not making it.
Oh, okay, two of us are planning. Yeah. Lonnie and I,
Oh, good.
so
Good.
he's part of it.
Mm-hmm.
That's as close as it's gonna get, so
Yeah.
I hate to miss it.
Yeah, I can't
Would
do it.
agree. You're right. It's not gonna get any closer than this, so yeah, you might as well try and take advantage of it when you can.
I can take the whole week off because I'm flying out on Thursday to go watch my son wrestle one. I know it's last year, so we probably.
You need to go watch him. I'm flying to Oregon to see the uncle that called me, but since he has cancer and I can see that he's not getting any younger, I'm gonna leave the day after our conference and. Oh. Yes.
Must be a good niece. I don't think I have any nieces that would fly anywhere to see me.
Dad for.
Huh.
And so, he's kind of, just really all that's left of my dad's family. Last year I went to say goodbye to my aunt. I knew that she was sick and, I flew to Arizona because I'm always on a tighter time frame, but my two older siblings that are retired, they drove to Arizona and, we went to see my aunt on Friday morning and we had she really couldn't talk, but she could smile and whatever. She knew who we were. She laughed at my brother's jokes, those kinds of things. And, she died within 24 hours. And I'm not anticipating that with my uncle, but, you just kind of, she was the second to the last. She was my favorite aunt. And now I just have to.
Is it a bid?
You gotta do what you gotta do for family.
Yep.
So,
We'll have a good trip. Thanks for coming.
all right, thank you. I'll switch places. How
Oh,
are you?
yeah.
See you, Pam.
Did
See
you make
ya.
them matter?
I know.
Gotta wait till,
Yeah.
what were we gonna ask him about?
If he's got any more bills on it.
Oh, on, the health center project. We talked with Christine this morning. She said to ask if you had any more.
we're gonna do that Wednesday.
But you
Put the
do,
windows in.
oh,
But there'll be additional
Yeah.
bills. That's what I told her. We told her that,
no,
No, she just wants to know if there are more bills coming,
Yeah,
that's all.
That was just all the materials I did. 'Cause
that's what we told her.
by the end of the year, so.
Yep.
Yep, so, all right.
Super. See you two-ish. So I think what we should do is just, you can let it keep running or pause it.
Well, there's this option that says leave. I think we can leave for a while.